Welcome to The Explainer. Today, we are getting into one of the most important jobs any caregiver has, looking out for a child's sight and hearing. We're going to build a super clear, actionable guide to help you do exactly that.
You know, that constant squinting you see, or that little tug on the ear? Those might be more than just quirks. They can actually be really important signals from your child. Today, we're going to decode those signals and dive into their sensory health, focusing on the common eye and ear conditions you really need to know about.
So, here's how we're going to break it all down. First, we'll talk about why this stuff is so important. Then, we'll get into vision, then hearing, and we'll wrap it all up with a practical toolkit so you know exactly what to look for and what to do next.
Okay, let's jump right in. Before we get to the specifics, we have to understand why catching these things early isn't just a nice to have. It's absolutely critical for a child's development.
Here's the bottom line. A child's brain is like a little sponge, learning and building connections based on what it sees and hears. So if that information is fuzzy or muffled, it can slow everything down. Their speech, their learning, everything. So getting them screened isn't just about their eyes and ears. It's about giving their brain the best, clearest information possible.
All right, let's switch gears and focus on our first sense, vision. We'll look at what you need to be aware of to protect your child's sight as they grow.
So, what even is a vision screening? Well, think of it as a quick, simple checkup for the eyes. It usually starts around preschool age, and its main job is to catch common problems, especially something called amblyopia, which you might know as lazy eye. That's when one eye just doesn't develop proper sight. And catching that early is a huge deal because the brain can actually start to ignore the weaker eye, which can lead to permanent vision loss if you don't step in.
And what's really smart is how the screening process changes with the child's age. For the little ones, they make it a game with pictures or symbols. For the older kids, it's that classic letter chart we all know. But the goal is always the same. Cover one eye, test, then switch. You got to make sure each eye is doing its job and seeing the world clearly.
Now, the most common reason for vision problems in kids are what we call refractive errors. It's a fancy term that just means the eye isn't bending light correctly, so things look blurry. Let's quickly compare the big ones you'll hear about.
This chart breaks it down perfectly. So with myopia, or nearsightedness, they can see things up close just fine, but things far away, like the board at the front of the classroom, are a blurry mess. Hyperopia, or farsightedness, is kind of the opposite. Reading a book up close can be a real struggle. And then there's astigmatism. That's a little different. The front of the eye is shaped a bit unevenly, so it's kind of like looking through a wavy piece of glass. Everything's a little distorted, no matter the distance.
Okay, so we've talked about how the eye focuses. Now, let's talk about something that can happen to the eye. You've almost certainly heard of this one, pink eye. It's caused by bacteria, and boy, is it contagious, especially in places like schools. The good news? It's totally treatable with some simple antibiotic eye drops.
If you're dealing with pink eye, how you care for it is everything. Pay super close attention to hygiene. That cleaning method, wiping from the inner corner of the eye outward with a fresh cloth each time, that is so important to avoid reinfecting the eye. And of course, keep your child home for at least 24 hours after starting treatment. And hand washing, well, that's your #1 defense against it spreading to everyone else in the house.
All right, let's shift gears to two conditions that are much rarer, but also way more serious. These can show up in babies, and they require immediate medical attention.
Okay, so even though both of these can make an infant's eye look cloudy, the details are really different. With a cataract, it's the pupil, the little black dot in the center, that looks white or cloudy. With glaucoma, the entire eye might look bigger than normal and hazy because of high pressure inside. Both of these are a big deal. If you ever see this, you call your doctor right away.
This right here is a huge takeaway. You know how when you take a flash photo, sometimes people get that red eye effect? Well, that's actually a good thing. It's called the red reflex, and it's a healthy reflection from the back of the eye. If a doctor shines a light in a baby's eye and that reflex is missing, where it looks white instead of red, that is a major red flag for something like a congenital cataract.
Now let's turn our attention to hearing, another sense that is just vital from the second a child is born. It's how they learn to talk and connect with us. So you want to be on the lookout for things like a baby who doesn't startle at loud noises, or maybe a toddler whose speech seems delayed.
This timeline shows you just how urgent this is. There's a really good reason almost every newborn gets a hearing screening before they even leave the hospital. It's because those first 6 months are an absolutely critical window for the brain to learn language. So if a baby doesn't pass that first test, the goal is to get a diagnosis by 1 month old and start treatment or support by 6 months old. It's all about giving them the best possible start.
Ear infections, they are one of the most common things kids get. But it's really important to know that there's a difference between an outer ear infection and a middle ear infection, because what causes them and how you treat them is totally different.
So it all comes down to location. Swimmer's ear is in the outer canal, the part you can see, and it really hurts if you just gently pull on the earlobe. A middle ear infection, on the other hand, is fluid that's trapped behind the eardrum, usually after a cold or respiratory bug. This happens a lot more in little kids because their internal plumbing, their eustachian tubes, are shorter and flatter, so fluid just doesn't drain as well.
And this is why we take middle ear infections so seriously. When fluid is constantly stuck behind the eardrum, it's like the child is trying to listen to the world from underwater. It muffles everything. And if that goes on for too long, it can seriously interfere with hearing and lead to major delays in their speech.
This chart really helps put those decibel levels into perspective. What do they actually mean? Well, a child with a mild hearing loss might miss out on softer speech sounds, like an S or an F. By the time you get to a moderate loss, following a normal conversation becomes really, really difficult. The whole point of screening is to catch any loss at any level as early as we possibly can.
Okay, we've covered a lot of ground, so let's pull all of this together into a simple, straightforward toolkit. These are the most important things you can do to be proactive about your child's sensory health. And here it is. Notice how simple these things are, but how powerful they can be. Great hand washing helps stop pink eye in its tracks. Never, ever putting cotton swabs in the ear protects that delicate canal. And something as simple as feeding a baby while they're sitting up can help prevent fluid from backing up into their middle ear. These everyday habits are truly your first line of defense.
At the end of the day, you are your child's #1 health advocate. You know them best. By being observant, trusting your gut when something just feels off, and making sure you get to all those routine screenings, you have the power to protect their connection to the world. So the real question is, with all this in mind, what new detail will you notice tomorrow?